Hello, everyone. Welcome to the Love to Live Healthy show with author and weight loss specialist Josephine Fitzpatrick. Our focus is weight loss and losing it with healthy and clean living. Join us every week to hear answers to questions from our clients all over the world who text and email thousands of weight loss questions daily. Listen and learn how Josephine answers questions to help you lose weight, eat healthy, and feel great.
Hi everyone, welcome to the Love to Live Healthy show. I'm Josephine Fitzpatrick and this is my co-host Jenna. Hi Jenna.
How are you?
So today we are talking about weight loss resistance. What a great hot topic. And we have our specialist, Dr. Fensky, who is going to explain so many different reasons why you could be having weight loss resistance. But before we do that, I would like to remind you, if you like the show, please give it a thumbs up. If it helps you in any way, subscribe, follow us. It really helps benefit our show in a big way. So thank you.
Of course. So I think it's time to welcome Dr. Fensky.
Yes, so exciting.
She's an OBGYN and she is here. So let's welcome her to the show.
Hi, Dr. Fensky. How are you?
Good morning, Josephine. How are you?
I'm doing well. So I'm so excited to have you on the show. Please tell us all about yourself to start.
Oh, wow. Okay. I actually am an OBGYN, certified OBGYN. I'm double boarded in OBGYN and integrative medicine. I did 2 fellowships after my residency. The first one was in laparoscopic robotic surgery, and the second one was the other end of the spectrum in integrative medicine under Dr. Andrew Weil.
Wow, that's amazing.
Awesome.
Yeah. Okay, so what I was super excited to have you on the show because you had done the weight loss program and you didn't have results, but then when you changed some things, which you're going to explain, you had amazing results. And really, the whole topic of the show is weight loss resistance and what are the different reasons that could happen to you. And, I feel like there's so many people today that when they just can't lose weight, they just give up and they don't realize it could be something underlying. So please tell us about your experience with it.
Yeah, absolutely. So even for me, I had a traditional medical training background. I had a great education. I was fortunate, but there were so many things that I didn't realize. You don't get a good education on nutrition in medical school. Essentially, there's really no education on nutrition in medical school. And then even in OBGYN residency, there's not a focus on these factors that can affect weight. So for me, it never occurred to me. I had my second child and the weight didn't really come off. So I reached out to Josephine and worked with Josephine, and I loved the program. I loved the concept behind it, but I wasn't really having results. And as anyone probably understands, it's incredibly frustrating to do the right thing, put the work in, exercise, and still not have any results. So I decided to do sort of a deep dive for myself. I was in the process of doing my integrative medicine fellowship, which kind of opened my eyes to a lot of other reasons behind why this resistance could happen. And for me personally, there was a few things. I had always had chronic insomnia. My sleep was awful. And we'll talk a little bit about how sleep can affect it too. And then the other thing was that my hormones, I was in my late 30s at the time, and it never even occurred to me because perimenopause in general just does not get a lot of light on it, and especially earlier perimenopause, which gets no light on it. We all associate perimenopause with the typical symptoms of hot flashes and night sweats, but I didn't have any of those symptoms, so it never occurred to me that there could be an earlier stage of hormonal imbalances in the perimenopause transition where your estrogen is much higher than your progesterone. And essentially, when I had kind of delved into everything, I was really surprised with first my estrogen levels relative to my progesterone levels, and just how sleep would affect your metabolism. So for me, when I made the changes and really focused in on those things, I went back on your program and it was great and it worked, and as long as I followed it and did the things I had to do, I had amazing success.
Right, which is amazing, which I love to hear. I was
Yeah.
so thrilled when you told me that whole concept, because it's so true. People get so frustrated, and it is. I have clients tell me all the time. They're like, "I promise you, I'm doing everything," and sometimes it is just something underlying, which I know. I do send a lot of clients to Dr. Fensky, because
That's great. Yeah.
when they do everything, then there's just has to be something else going on, and sometimes it could
Yeah.
be a number of things, right? Now, you just mentioned the perimenopause, which I think is huge, because I think that's such a big factor that there is not enough light shed on it, and so people don't even think of that. But what are some other factors that it could be?
A lot of the other factors, which we can kind of go into, actually apply to men and women the same, right?
Wow.
So really basic, and this is really well known, is obviously, and you even, ask this in your intake, are medications, right? So there's a lot of medications that people are on that can cause weight loss resistance and even weight gain. So, and there are needs. There are needs to be on certain medications, and that's something you kind of have to know and work with. But, very typical medications, antidepressant medications,
Right, yes.
some diabetic medications, some seizure medications, some other mental health medications also. And common is actually beta blockers, which is extremely common for people with high blood pressure conditions and so on. So
Now,
medications is definitely something.
When you say that, and I totally agree, and I've said to clients, listen, especially like, anxiety or antidepressant, you're on it and you need it. So we have to figure out whether it's just a slower weight loss, or is there another supplement that can be taken, to help them with that?
I mean, I think it really is personally dependent on how much somebody, what their symptoms are, right? If somebody's obviously suicidal ideations, then it's right for them to be on a medication. But I think there's a lot of instances, especially with anxiety, depression, where lifestyle modifications in conjunction with supplements really helpful for it. And I think in our culture, we're really quick to put a pill to make the
Medicate.
fix.
Agree, yes.
Yeah. So the thought process behind some good lifestyle modifications to be able to give you tools to deal with the depression and anxiety. And there are some great supplements actually that work really, really well.
Now, because I do find too, unfortunately, even with weight gain, that can cause the depression. So sometimes they go hand in hand, and you lose
It's
the
a
weight,
vicious
and
circle,
you
too.
actually just feel better. Yes, right, exactly. What about gut health?
That's a big thing.
Yes, this is a really hot. Yeah, it's a really hot topic right now. And I'm going to be honest, we're still sort of in our infancy of our knowledge of it. And I'm sure that when you fast forward years from now, everyone's going to be like, wow, we knew nothing about gut health. But at least even, the medical community across the board has recognized the importance of the gut microbiome. And basically, when we evolved with bacteria. So we actually have, and this is not disgusting, but we actually have more bacteria in our body and their cells than our own cells. And there's, definitely a symbiotic relationship and benefit to bacteria. But, there's lots of instances where we throw off the amount of good bacteria that we have and get more bad bacteria. And with the bad bacteria, it can affect mood, obviously, gastrointestinal function, and also it can affect directly metabolism and weight gain, weight loss. So, there's a lot hand in hand that's looked at in the functional medicine community. They will often do stool testing to look for short chain fatty acids, to look at the balance of the good bacteria and the bad bacteria. But I think that if you're someone who's also having a lot of GI issues, gastrointestinal issues, whether it's bloating or irregularity, or somebody who has not only, and you had mentioned it's kind of confusing, right? Because weight gain, but a lot of mood disorders too, and then also a lot of GI, then you kind of want to start thinking that possibly the cause of your weight loss resistance might be related to the gut microbiome.
Right, which makes so much sense.
That makes
Yes.
a lot of sense. Now, I'm 23 years old. Do you look for different things for different ages? So would you be looking for different underlying factors in someone who's older than me or at my age? What would you be looking for?
Yeah, I mean, in some instances, yes, right? So generally when you're going to look at things that can impact weight, right? Like I've mentioned, the medications, hormones, thyroid, the gut microbiome, sleep, and then a whole other category, right, that brings you into toxins and endocrine disruptors and mercury. But especially a woman in her 20s, then you're obviously not going to likely think perimenopause, menopause in regards to hormone imbalances, but there are other factors. So there are conditions called such as polycystic ovarian syndrome, and then things like fibroids and endometriosis. And there's kind of this divide in regards to this, but physiologically, we know that there are certain conditions and certain times in a woman's life where her estrogen is higher than her progesterone. And whether you want to call it estrogen dominance or just imbalance, that's up to you, but it does exist. In a woman in her 20s, for example, and I've had quite a few patients like this, where they have, I'll take PCOS, for example. They'll come in complaining that they may have irregularity in their cycle, they're skipping months where they're not getting their period, maybe some excess hair growth on their body, and then weight issues and really difficulty losing weight. Immediately, it sends up a red flag, especially for this age group, of polycystic ovarian syndrome. And polycystic ovarian syndrome is this complex gynecological condition which, directly possibly leads to metabolic syndrome down the road. It has a direct impact on thyroid. It has a direct impact on metabolism, puts women at higher risk for diabetes, thyroid disorder, and heart disease. So it's really important to investigate this and treat this. But with polycystic ovarian syndrome, there again is a higher amount of estrogen relative to the progesterone. So what does that mean, right? Why would that cause weight gain? But with the higher amount, when there's a higher amount of estrogen, then what happens is there's a higher amount of thyroid binding globulin. So there's a molecule that floats in our body that holds on to our thyroid hormones. And the more thyroid hormone we have bound up, the less free or bioavailable thyroid hormone exists. And we know that thyroid hormone has a direct impact on metabolism. So higher estrogen, higher thyroid binding globulin, and then less thyroid available to really work with metabolism. So polycystic ovarian syndrome, definitely something you think about in 20s. And then things like endometriosis and fibroids, which a lot of women in their 20s will start having symptoms of, is also directly linked to higher levels of estrogen versus progesterone in the body. So the same things come into play.
Wow. So much good information.
Oh my God,
I
know.
do have a question. So the thyroid, I hear clients will say, I went and had a thyroid test and it was negative. But sometimes it's obviously just not as simple as that.
True.
Because you're saying
Yeah.
the polycystic will affect the thyroid, but that's not going to come up in a thyroid test, right?
Right. And a lot of times the thyroid testing that's done is really basic. For example, most doctors order just thyroid stimulating hormone, or TSH.
Right.
And if it's normal, then no further testing, right? Nothing else is done.
Exactly.
A full thyroid panel is going to look at your T3, your T4, your antibodies to it, which is going to give a more comprehensive look. And sometimes when you dive that deep, you find that there may be what they call subclinical hypothyroidism, where TSH is normal, but the actual amount of thyroid hormone is low and abnormal. So that's also the interesting.
Which is so, I think that's really interesting for people, because sometimes it's not so much as one test and you walk away saying, oh, okay, I'm fine. Sometimes you do have to go deeper.
Yeah, that's super important.
Yeah. And I think that it's important for men, women in general, to know the importance also of sleep and how it affects your metabolism. We, especially during stressful times and life itself, a lot of us have not such great sleep, whether it's frequent waking or difficulty falling asleep, or just the number of hours we're getting a night.
I can relate.
I'm totally a victim of this.
Yeah, I love that you brought up the sleep. Tell us more, like how I say to clients all the time, are you sleeping? Not even the fact that they could be night eating because you're up.
Right. Yeah.
What are the other side effects of it that really, men and women, it really interferes with the weight loss?
Yeah, I mean, this is motivation right here, just to get a good night's sleep. But poor sleep leads to elevated ghrelin hormone, and ghrelin hormone is your hunger hormone. And when I was in medical school, it was so hard for me to remember leptin versus ghrelin, and 22 years old and so on. So I always thought of ghrelin as like, I'm hungry. But lack of sleep or poor sleep leads to higher levels of ghrelin hormone, and it leads to lower levels of leptin hormone. And leptin hormone is your satiety hormone. That's what tells your body, like, I'm full, I'm not hungry, I feel great. But the lower levels of that leads to what? More eating. And I think that all of us have sort of lived this. One example is, for me in residency, the long hours, the overnights, our night float shifts, I was starving. I just was, oddly enough, more hungry. For people who do sort of like an all-night flight, a red-eye flight, then usually in the morning, they're like surprisingly much more hungry than they normally would be, or when they come home, they're much more hungry. Mm-hmm. But I think that we don't make that association, but you can live it and look back and see that lack of sleep, poor sleep, immediately has that relative consequence of you're hungrier, and you just need to eat more and more.
I'm sure that plays a part, because I feel like less and less people sleep today.
Yeah, for sure.
For all different reasons, for everything that's going on in the world, to just, inside their home. That's a big factor.
These are all like amazing factors, and all the information she gave is just so important. And I really want to, thank you again for joining us on the show.
Thank you so much. It was such a pleasure to have you.
Thank you.
I love all the information. So many people are really going to benefit from everything you said. So thank you so much.
Thank you. It's so great to see you guys, and have a great rest of your day.
Thank you. You too, honey. Have a great day. That was so great. What an amazing amount of information.
Yeah, she's just so amazing. Mm-hmm. And if you want to check out all the amazing stuff she's doing, we will link her information down below.
Yes, or if you want to get in touch with her.
Sure, yeah. She does telehealth, she does all of that. She's in New York City. Mm-hmm. And if you want to check us out, which we hope you do, we are innovationweightloss.com. Mm-hmm. You can follow us on Instagram at innovationweightloss. I'll put our other socials down below too. And if you have a hot topic, question, or if you want to be a guest on the show, you can email innovationweightlossmedia@gmail.com. We also have a prepared food store in Woodbury. And we're opening, where are we opening?
East Hampton in mid-May. We are super excited, and you will also be able to purchase some of our delicious products. So please stop by and visit us. We will give more information as we get closer. It is mid-May, and we are super excited to be there.
Thanks for listening to Love to Live Healthy with Josephine Fitzpatrick. We hope you'll pass along our web address, innovationweightloss.com, to your friends and colleagues who are looking to lose weight by eating clean and living healthy. Be sure to check out our archives section on our website for previous podcasts. Join us next time for another edition of Love to Live Healthy with Josephine Fitzpatrick. The content in this podcast is not intended in any way as a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified healthcare provider with any questions you may have regarding weight loss or any medical condition or treatment, and before undertaking a new healthcare regimen. And never disregard professional medical advice or delay in seeking it because of something you have listened to on this podcast.